So what does that look like now when we're saying it's time to go? The funding has been allocated, but now how do we get started? What are those next steps?
Well, a lot of these strategies are hinged on state procurement rules.
Mm-hmm.
So, again, and every state is different.
Mm-hmm.
So, it's been a significant investment to put a team together to really manage this process to help our customers, help the states that we serve to get new, fresh, transformative ideas into the marketplace on how a virtual health system could help them achieve their goals.
Mm-hmm.
Also, there's another element, and I touched on it earlier about speed and about time, and because these states need wins. It's as we record this, it's the middle of March, and the federal fiscal year is coming up at the end of September.
Mm-hmm.
There's thresholds there, and then additional thresholds over the next year, and so it needing to find partners that can implement shovel-ready projects.
Absolutely.
That's a construction term, obviously, but it's germane to this discussion because we can implement quickly.
Absolutely. When you hit on the transformation, that's been a huge word that is not that it's new, but it's definitely been utilized in a new perspective, I would say, in the last few years. And how has Avel eCare really now, or how do we want to play a part in this transformation of the funding? How do we become a partner with some of these communities and sites?
Yeah. If you really want to be candid, we've been doing rural health transformation since our inception in 1993. That's how we got to be who we are. And as technology has advanced, as services have advanced, you think about starting out in specialty care and doing those virtual consults to school health, to EMS, to crisis care. The list just goes on and on and on.
Yeah.
So you want to define transformation? Do a case study on Avel, because that's what we've been doing for our entire existence.
Absolutely. Well,
and not only on a services perspective, but from a technology perspective. And so, it's a good time to be here.
Well, I appreciate you going down the list of all of the different services that are provided, because what does that mean? Some sites have one service line and some have multitude. What does that mean for someone to really have the full continuity of care with Avel? What does that really look like, and what does that mean?
Yeah, that's a great question. And it's really, that really validates that virtual health system concept that has become so prevalent in being able to support our customers. Having an entire platform of services available to them, and being, in many, many shapes and forms, technologically agnostic to whatever that customer has made a decision around for an electronic medical record. I think I was talking to one of our providers recently, and I think she said she had 27 different EMR passwords.
Wow.
Just because that's the many variations of EMRs that were out there. And so, that's a great question, and something to ponder about. We're just so different.
Yeah, absolutely. So now, kind of going back to with rural health transformation, when we're looking at everything that Avel provides and offers, how do we now implement some of that into, getting into the funding and working with the states to really help them meet their initiatives that they've put forward? Yeah,
that's a great question. That keeps me up at night, to be real honestly. Sleep is a premium anymore, but a lot of the RFPs are starting to come out because CMS approved the funding, and I mentioned it. A lot of this depends on state procurement laws, and so there's been a great deal of learning that has gone into those processes, but also there are just some states it's hard it's going to take a while for them to act on the premise of rural health transformation, because in a lot of cases they've got really arcane procurement laws. There are some really big states out there that it's going to take months and months for them to get some of these dollars to work. That they've been appropriated, or not appropriated, but they've been granted by the federal government. And so I'm concerned about that. And there's some states where we have a big presence and support lots and lots of hospitals that may just not see some of the fruits of their labors as quickly as maybe they had hoped.
Yeah. One part of that too, looking at, telemedicine as a whole, as a part of some of these initiatives. I know we talked a little bit about, before COVID, no one really talked about telemedicine and the impact that it made, and then it blew up, but we've always been around and we've done this before. So what is that when we're talking to different healthcare leaders? How does telemedicine play a role into that now versus what it used to be? And how does that play a role into this funding?
Yeah. I'm going to reflect back on my military career. And what were those, tactical advantages that we had as an organization to help us accomplish the mission? I really look at telemedicine as that combat multiplier. It's a strategy, and a strategy with years and years of proven performance to help a community, a healthcare provider, or a government to meet their goals and do it on time, on budget, and really, be there to help them achieve their mission.
Yeah.
That's really how I think about
That's a cool way to think about that.
Yeah, it's just that's kind of how I was raised. I did that for a long time. So how do we accomplish the mission? And I think for a lot of these folks, telemedicine is a key role to that.
So for those that are still a little iffy about this, which you don't see that as often anymore, but there's still some that don't love the full aspect of that. How do we get to them and say, how do you prove that telemedicine can be part of the solution as a whole?
Yeah, that's great. And one thing that really sets us apart from a virtual health system is our Joint Commission accreditation. Getting that seal of approval and recognition from a quality perspective that we're a very attractive option. Super proud of our team and the folks that work really hard every day to make sure that we provide the best care, best service possible. And that's significant. And talking to somebody recently who in the government space, and they had no previous knowledge of us. I had never met this person, but explaining to him who we are, he and again, it's a government official, and he looked me straight in the eye and said, "Sounds like we need to be more like you."
Yeah.
And so I invited him to come for a visit and kick the tires and meet the folks, just to be able to show him and show his team just what a virtual health system looks like.
That's amazing.
Yeah, it's a pretty fun combo.
Absolutely. Well, when you get to see it, it's a whole new ballgame.
Yeah.
Yeah.